then you can, wherever you're going to set up. Get out of bed. Yeah, at least 15 people, yeah.
Travis has been here, I guess 10 years ago you were here when the...
Long time ago. I looked a lot younger. So did everybody here, though.
So did we.
Yeah.
So did we. But they showed you how to use the equipment downstairs. I really think we should have them more often because the latest tips, and some of you have already gone to physical therapy either with Robbins or various other places around the community. But it's always a good thing to find out how you can work with your aches and pains and back and whatever else, hemorrhoids, whatever that you have to work with. So I'd like to introduce Travis and Tyler. Take one.
Take one. There you go. All right, guys. Thank you for coming out on this morning. It made it sound like she got you out of bed. Do you guys really wake up this late? Is that what happens? So I have to be to work at 6 a.m., so I have to get up pretty early. So I'm looking forward to this. The first time I came here, it was like 10 years ago, and I didn't know anything about 55 and older communities, and I saw this place. I was like, oh my God, I cannot wait till I'm 55. This place is awesome. So that's really cool that you guys are living in one of these communities. And I've treated a lot of people that are here. Some of my patients are here now. Nobody's admitting to it, but one person here did come to see me, I guess. So, all right. So what is the idea of today? So it's a workshop, so it's very interactive. If you guys have any questions about anything as we're going along, just throw your hand up, and we'll make sure that you get your questions answered. But this is very informal. This isn't like college where they just kind of talk to you. I've got to have your interaction. And actually, we're going to have, if somebody's interested, come up, and we're going to do some treatment today to kind of see what physical therapy would look like and see how that can help people. Has anybody had physical therapy before? Yeah, a lot of people? Okay, good. All right. So I'll tell you a little bit about me. My name is Travis Robbins. I'm a twin brother. There's two of me, so you'll never really know if this is me or my twin brother, Todd. But he's on the other side of the valley. So we started Robbins Rehabilitation almost 14 years ago. We're originally from upstate New York. I grew up milking cows in upstate New York and found out working 17-hour days and losing money at the end of the year was not like the most fun thing to do. So I went into physical therapy. We went to Ithaca College. You guys know where Ithaca College is? All right, cool. So got out of there, and we always wanted to go into business together. So I was 24 when I opened up my own practice down here. And now we have 5 locations. So we have Upper Macungie, Allentown, Bethlehem, Easton, and Phillipsburg. So we kind of span the valley here. But for you guys here, this is mostly our Allentown location. We have 2 Allentown locations. One is kind of Upper Macungie, but they're both Allentown addresses. I have a lot of roles. So I'm a physical therapist, right? You can verify that. I've actually treated you, right? So I still treat patients a ton. I'm a dad. I got 4 kids. I'm a husband. I've got a great wife. I'm a coach. I coach all my kids' soccer teams. But probably one of the most important roles that I have is that I'm an educator, and that takes a lot of different forms. Right now we have 3 physical therapy students that are in our offices that are learning from us. They come do rotations with us, so we have to kind of teach them everything that we know in a short period of time. I teach at colleges around here, so I teach down at Widener. I teach mobilization and manipulation down there. And I teach my physical therapists, right? So everything that I know, I try to pass on to them. But probably the most fun that I have is educating in this scenario. So I have a lot of information. I went to school for a long time. I've got a lot of experience. I have a lot of high-level information. The challenge for me and the fun for me is to try to take that information and in like 30 minutes get that information down to a level that you guys can understand. So that's my job today, and this is like the most fun 45 minutes I'll have of the week because I love doing this stuff. So we're going to follow along on your sheet here. And so you didn't have to fill this in. If you filled it in already, you get extra credit. Good job. But we're going to follow right along here. And again, if you have questions, then we'll talk about that. So I want to talk to you about how I became to specialize in low back pain. So physical therapy in general is a lot of low back pain. So spines and foot and ankle are the two places that tend to wear down as you get older. So we see a ton of that. So when I first got out of school, I didn't have any experience, right? I did rotations and I treated some patients, but when you first get out of school, you don't have a lot of experience. You have a lot of knowledge because you went to school for a long time, but you don't have a lot of experience. So in the beginning, what my success rate looked like with physical therapy and treating the spine looked something like this. So about 25% of my patients came in, they had back pain. I implemented some treatment and they got like 100% recovery. They loved me, they wanted to adopt me as their second son. About 50% of people, they got better. Like the things that I was doing was helping them. They definitely benefited from physical therapy, but they didn't get a complete resolution of pain. They didn't get exactly to where they wanted to get to. And they had a good experience and they got better, but not exactly where we wanted to get to. And 25% didn't get any better at all. No matter what I did, what I threw at them, I tried everything. I tried as hard as I could. I was a nice guy. They liked me. They came in for physical therapy, but I wasn't helping them. And that was kind of frustrating for me. So a couple years into owning my own practice, it was me, my brother, and Kelly, who is still a physical therapist with us in our Bethlehem office. This guy came in, and we still call him Super Dave. That's what it is on your sheet here. So most people come in with like a one-page or a page front and back of a resume. This guy had a 4-page resume. It was 10 font, and it was single-spaced of all the different things that he did. So in terms of schooling and accreditations and teaching, he was on faculty at a bunch of different schools, and he knew all this stuff. And he just kind of dropped his resume off, and then I had a secretary at the time, and she handed it to us, and my brother and I were looking it over, and we're like, we probably should hire this guy no matter what, because we could at least learn some stuff off him, right? So we hired him. He started working for us full-time. I gave him a really hard time. So he was in the area because his wife worked for Crayola, and she was an executive there. She was making a ton of money. Physical therapists don't make much money. So he would work part-time, and then the other part of the time he would golf because his wife made so much money. So we only worked for us part-time. But every Tuesday he would do class with us. So we started treating next to him. I remember the first couple of days, and it was treatment tables are kind of lined up along the wall, and it's me, Kelly, and Todd, and Dave is on the end. And he's starting to get new patients and see them. And I see my patients are kind of like looking down at what Dave is doing. And then eventually I'm looking down at what Dave is doing, and it's completely different than the stuff that we were doing, the stuff that we learned in school. And so pretty soon my patient's like, hey, how come we're not doing that stuff? So we ended up saying, hey, let's meet on Tuesdays. We met for 2 hours every Tuesday for about a year, and he kind of taught us all the information that he could teach us. And he came to me at one point and he said, this is good, but I think you should really go on and get the schooling for what I did. And he did a manual therapy fellowship program. So it's basically for 2.5 years, every other month I would go to Chicago and I would take a weekend's worth of coursework and then apply that and then keep going back through 2.5 years. And then after that, it was another 2 years of fellowship that I did underneath a faculty member where I would go in, and it's just like going back to PT school now where the kids come in and they kind of follow me around and I can kind of take them through the paces, and I had to do that again. So it's basically like going back to school all over again to learn a lot of different techniques that are more effective in treating low back pain. So now what this looks like is about 90% of the patients that come in for low back pain, complete resolution. And about 10%, I can't quite get them exactly to where we need to go. I don't like to admit that. I'm trying to get that percentage smaller, but some people do fail conservative therapy. And a lot of times what we do is we try other things. So we tried acupuncture, chiropractic, different modalities, looking at diet and other movement type stuff that we won't get into now. But for the most part, everybody that comes in has much better results than what's going on here. So that's why I've seen the power of that, and I've seen that not every physical therapy place does that. And I want to try to get this information out to more people so they can benefit from what we have to offer. So now we're going to talk about and do some background anatomy education on sciatica and low back pain. Anybody know what sciatica is or had sciatica? Okay, so what do you think sciatica is? How would you define it? Yeah, so perfect. So sciatica is just kind of, we say like a garbage pail term for anything that causes pain down the back of the leg. There's lots of things that can cause pain down the back of the leg. We're going to kind of go over what that is, but sciatica is just a term for anything that either starts in the low back or pain down the back of the leg. Okay, so the sciatic nerve is the what nerve in the body? What do you think that word is? What's that? Yeah, so the sciatic nerve is the what nerve in the body? And the fill in there. So it's the longest, okay? Longest or the largest, yep. So you can put longest or largest in there. So it's actually the thickness of your thumb. So, and its largest point, if you stick out your thumb, that's how big your sciatic nerve, it's huge, okay? And it's actually 2 nerves. That's what that next space is. So it starts in, the next space here, it starts in your low back, so it's what's called nerve roots that come off of the spinal cord, and they come together and make this big nerve that goes down the back of your leg. And then once it gets about a couple inches above your knee, it splits off into 2 other nerves. So to the outside, it splits off into your peroneal nerve. So it goes down the outside of your leg there, and on the inside, it splits off into your tibial nerve, and then it splits off into a bunch of other nerves that you don't need to remember. But it's important to know that it's a really big nerve, and it kind of splits off into 2 nerves. So the last line there is sciatica sufferers may experience what numbness or what in the leg? So symptoms that you would have. Pain, perfect. That's the first one. Pain, numbness, or what in the leg? Tingling. Who said that? Winner. Yep. Those are the most common complaints that we get from patients that come in with low back pain. So it's pain, numbness, tingling. Some people will say burning. Some people will say, I feel like there's hot or cold water running down my leg. Whenever someone says kind of like a funny symptom, and they feel kind of embarrassed to say it, like this guy's going to think I'm crazy, but I feel like someone's dumping hot water down my leg. Any kind of weird symptom is usually a nerve-related symptom. And that feels different than other soft tissue that can be affected in the body, which we'll talk about. So any kind of numbness, tingling, burning, pain, or something weird, then there's usually some kind of nerve compression that's going on. All right, next one is a question. And this is probably, if you don't listen to anything else I say today, pay attention now. And is the pain, numbness, or tingling, so when I'm doing an evaluation on somebody, if the pain, numbness, and tingling is reducible, or if it's reproducible, so if I can get you to do something to make the pain worse, then the next line is, if so, then it's likely reducible. So if someone comes in and says, I have unrelenting 9 out of 10 pain all day long, never changes, never gets any better, that's not a physical therapy problem. That's a medical problem. There's something going on. That happens occasionally, a couple times a year, someone will come in with that, and we have to kind of refer them out. But for the most part, it is kind of changeable. Like you can do something to change it. Something either makes it better or something makes it worse. And that gives us information about what is causing the pain. And that's the most important thing. If we can find out what's causing that pain down the back of your leg, which we talked about, there's lots of different things that cause that. If we can find out what's causing it, then we can be more effective in treating it. All right, so now this is something that you guys are gonna fill out. So it says, I have pain with, these are the most common things that we see, but if there's other things that you have pain with, then write them down after that. But standing, walking, sitting, lifting, so like bending down to pick things up, doesn't necessarily have to be something heavy, not like lift a couch, like lift a bag of groceries off the ground or lift up your shoe up off the ground. Changing positions. So this would be, a lot of people will say, when I change positions at night, if I change from side to side or from my stomach to my back, or changing positions can be getting in and out of a car, especially if you have a car that has a low seat to it, kind of changing positions there, that can cause some pain. Golf or tennis, so these are my rotational athletes, so people that play golf. You guys have golf course here, right? Anybody play golf out there? Yeah? All right, good. All right, or running. So if any of those things bother you, then just circle it, because that's going to give us more information to help you find out what's causing your pain. All right, so now the next thing that we're going to do to try to find out what's causing your pain is we're going to do what we call in physical therapy a motion diagram. So we're going to kind of look at how much motion you have, but more importantly for you guys right now, I want to know which motions change the pain, which motions either make the pain worse or make the pain better. So if you feel comfortable, if you're in a lot of pain and you don't want to do it, you don't have to, but everybody that wants to, I want you to go ahead and stand up because we're going to try to find out what's causing your pain. Okay? And we're just going to go through 4 motions. Okay? So the first one is just bending forward. So I want you to keep your legs straight, and then you're just going to kind of bend forward as far as you want to go. And notice what happens to your pain. If it goes from 0, you have no pain, and the pain gets worse, that's important. If it makes the pain better, that's important too. Right? So just kind of bend forward, and then come back up. Hey, if that makes your pain worse, then just kind of circle it on the sheet there. The next one we're going to do is bending backwards. So it's the opposite motion. Put your hands on your hips here, and then extend back. And what does that do to your pain? Does that make the pain worse, better, or does it stay the same? Next what we're going to do is you're going to put your hands on your side, and you're just going to slide your right hand down your side. Okay? Good. And what happens to your back pain when you do that? Does that make the back pain worse? Okay? And then come back up, and then same thing on the other side. and we're going to the left side, especially with this one. If this changes side to side, that's important. All right, so on your sheet, just kind of circle what you came up with. Did any of those motions make the pain worse, better, or did it stay the same? All right. Did anybody have pain with any of those motions? You did? You want to come up here and, well, kind of check it out? Free physical therapy. You can't beat it. All right, so what's your name? Leona. That's a pretty name. Hi, I'm Travis.
I know. Hi, Travis.
You want to tell us a little bit about your back pain?
I have seized degeneration of the pelvic. Oh, it's my pelvic. I have the bottom of my bone, bottom of my back is all seized together.
So it's fused together? Okay, they've told you that. So did
Not
you have a
fused,
fusion?
No. It did it itself.
Okay, right.
So when I bend over to this side, if
Uh-huh.
I'm standing this way, I have a pull right up here.
Okay. It's just on the right side?
Nope,
Okay.
it's on the left side.
Okay.
This side is worse.
Uh-huh.
Like when you say go this way, I feel the pain coming up here.
Okay.
And then when I have to go this way, I can feel the back coming up this way.
Is one of those ways worse than the other?
This one,
So when you go to the left or when you go to the right?
when I go to the left.
So when you go to the left, it hurts worse on this side.
Yeah.
Okay.
In there.
All right. So let's do that. So slide your hand here. All right. And now 0 to 10. 0 is no pain. 10, we should go to the hospital. What number would you give it?
No, I give it an 8.
8. Okay. And come back up. All right. So I'm going to do something. I want you to do the same thing. So slide your left hand down your side.
Here,
Yeah, left hand.
here.
Nope. Here, we're gonna do the same motion we just heard.
can't.
That's all right. All right. So come back up from in the middle. All right. Now just do the same thing we just did. So left hand down your side. All right. And when you do that, is the pain worse, better, same?
No, it's not bad. It's just,
So it's better.
yeah,
Okay. So why is that better when I did that?
congested it, that's why.
Right. So what's that? Right. So I stabilize that side. Right? So if you have pain with motion, and then I go in there and do something to provide stability, I'm doing the job that the muscles are supposed to be doing. And if that feels better, that usually means the muscles aren't turning on properly to stabilize those joints.
Okay.
So what's happening, and it sounds like you've had some MRIs, right?
I just had a CAT scan though.
Just had a CAT scan. Okay, and what did they tell you?
Well, that the bones down in here, right here,
Mm-hmm.
are all together, they
Okay.
seized.
Yep.
And wasn't through surgery or anything, it was just my body went.
Yeah, it's part of the natural aging process, right? So let's talk about that a little bit. So there's discs in between each of the segments of your spine. Do you guys know about discs? So what's the main job of a disc? Anybody know?
Flexibility.
Flexibility. What else did somebody say? Cushion. All right, that's what I'm looking for. So everybody thinks that, and it does cushion segments to some extent. Its most important job is that it's a ligament. Okay? So a ligament attaches bone to bone. So the easiest way to describe this is, has anybody ever sprained their ankle or know someone that sprains their ankle? And so what happens when you sprain your ankle is that the ligaments on the outside of your ankle get stretched out. And if you've ever sprained your ankle or you know someone that sprained their ankle, they usually do it over and over again, right? So it's not just usually one time they sprain it. They typically have a problem with that ankle going forward. It's because the ligaments aren't holding the outside of the ankle together as well as they used to. They're kind of stretched out. So you get kind of this chronic excessive motion in the ankle. Unless you strengthen up the muscles to stabilize it, then you're probably going to continue to have that problem. Same thing with the ligaments that are in the back. The disc attaches one segment to another, and then if you don't do anything to turn the muscles on to stabilize that, you get excessive motion, and that causes increased degeneration. So that disc will get smaller and smaller as you get older if you don't do anything about it, and it will cause pain, and it will cause excessive motion that, if not checked by the muscles that stabilize here, then it will cause irritation, pain, inflammation, that kind of stuff. So that's a super common presentation that would happen. All right, so what kinds of activities during the day bother you?
Well, right now, just about everything, because it hurts so bad.
Mm-hmm.
But if I'm bending over
Mm-hmm.
and I stay in that position too long, I have a hard time straightening out.
Okay. How about like standing and walking? Like if you walk in a grocery store?
I lean on the cart, so
Okay.
it kind of helps me better.
Okay.
But if I stand too long, the back gets real tight.
Okay. All right. Anybody else like that when they walk? Yeah. Anybody seen the person that walks on the grocery cart like this? Yeah.
Well,
Yeah.
I was told, and I'm not sure if this is true or not, that if I get on, this is what I was told recently, get on a bike and lean forward so I stretch the rest of those discs out, at least I'll be able to, keep those discs so I can move a little bit more.
Right. So you don't want to like throw in the towel and say, well, my back doesn't look that good on diagnostic findings. So, well, I just give up now. Yeah. So what you were told is very important. You have to kind of continue to the ones that are good.
Right.
You want to try to make sure they stay good.
Right.
And the ones that aren't so good doesn't mean that it's a lost cause. It just means they might require a little bit of maintenance.
Yeah.
So,
I don't know about the maintenance. That's what I hate going there and having him make me twist and see if it's okay, and then I'm sitting there like going home this way.
okay. So it's sore after you go to your doctor, or chiropractor?
Chiropractor. Yeah,
Okay.
well, it's not his fault. He's just adjusting everything
Okay.
the way it should be.
Mhm.
But then I get sore when I get home because it's like, they were worked on.
Yeah.
That kind of stuff.
Okay. All right. So standing here right now, you've been standing here for a couple minutes. Is the pain worse, better, same as when you were sitting?
I don't have any pain when I stand.
Okay. So right now, no pain.
No pain.
It's only pain with those motions.
If I stand too long, like for 20 minutes to half hour,
Okay.
then I'll get the stiffness in my back.
Okay. All right.
And I have to go like this to kind of stretch.
Okay. All right. And so right now, when you go to, that's the worst pain when you go to that side, and you're saying, Yeah.
This is the worst
Yeah.
because it pulls. I don't know how to tell you.
Yeah.
But if I go this way,
Mhm.
standing straight, it's pulling here.
okay. So let's see if we can do something about that. So can you lay onto your back on this table? All right. Happens every time. Every time I do this. So lay onto your back.
Sorry.
So lay onto your back.
My back. Oh, well,
Yep.
when she said back, I thought,
Yep.
oh, hold on.
Yeah, you're okay.
I'm so used to going to the chiropractor. Okay.
That's true. All right, so first thing I want to look at is a nerve tension test. So I want to see how these nerves are moving. So we talked about the sciatic nerve that goes down the back of your leg. I want to see how that nerve is moving. So a sciatic or any kind of nerve, you can't stretch it. If I found someone that had tight hamstrings, anybody have tight hamstrings when they bend forward, they feel pull and stare? I can stretch that out, I can mobilize it, I can give you things to do, and actually change the length of that. I can't change the length of a nerve, or at least I wouldn't want to change the length of a nerve. If I stretched out a nerve, I would damage it. Think of a nerve as being like a rope or a wire that runs from one place to another. And that rope or wire has to kind of, as it comes out of your lumbar spine, it's got to go past your discs. It's got to go through your vertebral foramen, which is like this little hole that the nerve has to escape out of. It has to go over top of muscle, kind of through bone. It has to go through connective tissue like fascia. It has to go through a lot of different places to get to its endpoint. And if there's pressure on the nerve, or if there's any kind of restriction, if that nerve isn't gliding properly, then that can cause pain, numbness, tingling, burning, or it can cause a decrease in muscle function too, which we can talk about. So from here, just relax and let me know when you feel a stretch when I pick your leg up off the table. Okay, where do you feel it? In there. Okay. If I do this, then what happens? Worse, better, same?
No, it's better.
Feels better when I do that? Okay. And then relax here again. And then feel the stretch in the back of the leg. Okay. And then if I do this, then what happens to that stretch? Oh, that's more. Down here.
Yeah.
Okay. So if I lift your leg up, you should feel a stretch in the hamstring. You should feel a stretch in the muscles in the back of your leg. If I pull on your foot, I can't change the length of any muscles that are here. Okay, the only thing I can have an effect on is the sciatic nerve. So when I pull and I mobilize her sciatic nerve, it doesn't like it. It's kind of cranky, right? So that should move normally. If that's not moving normally, then something's wrong. Okay? So it doesn't mean there's nerve damage, right? It just means the nerve's not moving properly because of the history that you've told me. That kind of makes sense. I'd be surprised if it didn't have some kind of positive nerve finding. So same thing here. We're going to check this side. So let me know.
Okay, you got it now.
If you feel it in the same spot as the other one, just in the hip back there. Okay, and then if I do this, then what happens?
Kind of pushing it down in here.
More in there, a little more. Still no muscle here, whether you feel it in the back of the hamstring or back of the hip, there's no muscle there I can change the length of by moving her foot, right? So there's only that sciatic nerve that I can have an effect on. All right, so can you lay onto your left side? There you go, good, and relax here. So she's saying that when I lean over to the left, my right side doesn't feel, I feel like a pull there, a stretch. So there's lots of structures over here. There's facet joints in the spine. There's soft tissue structures like nerves that we talked about. There's other soft tissues like your quadratus lumborum and other muscles that you don't need to remember the name of. But all I want to do is try to see if I can get that stuff to move a little bit better, if we can decrease that pain. So part of the problem we talked about is a stability issue. Like if you're not turning on the muscles properly to stabilize that motion, that can cause pain. Okay? And part of it is a mobility issue. So things aren't moving the way that they should. So I'm addressing right now the mobility issue. So I'm trying to get these things to move a little bit better. You doing okay there?
Mm-hmm.
Okay. So this is similar. If you guys, has anybody ever gone to a chiropractor before? I know you have.
Mm-hmm.
Yeah. So similar to what a chiropractor focuses on joint mobility for the most part. Now, all chiropractors are different. So, and I'm not here to say chiropractors are bad. I go to a chiropractor. So clearly I don't think chiropractic is bad. We use chiropractic in our practice. But a lot of their focus is on joint mobility and not so much the stability. You typically won't get corrective exercise, which we'll talk about a little bit later, when you go to the chiropractor. That's where physical therapy differs kind of. Right? Are you doing okay there?
It's pulling.
Yeah, so it should feel pulling, pressure. You shouldn't feel any sharp pain.
No, no.
All right, and then lay back over onto your back. All right, so I'm going to show you a really simple nerve mobilization that you can do. So a lot of what I do is not rocket science.
I'm going to get paid at the end of this.
Yes, I planted her back here somewhere. This is my grandmother, actually. All right, so lift up here.
I could be.
All right, so you feel a stretch there?
Yeah.
Okay, and then bring your toe down towards you, and then back up, and then keep going back and forth. Okay, so all you're gonna do is you're gonna bring this toe down towards you, and when you should feel a stretch there. Yeah, yep. So not pain. You don't want to feel numbness, tingling, burning. You just want to feel a stretch. So just keep going back and forth there. So where do you feel it? They want to know. Just kind of the back of the leg, calf.
Calf.
Yep. So when she feels in her calf, that could be just the calf lengthening, right? So, but I know for sure I'm moving the nerve because I'm taking the very end of that nerve and I'm pulling on it and I'm gliding it through the path that it travels in. So part of that, she should be feeling some calf stretch for sure. And you can feel this, you typically feel this where the nerve is restricted. So if someone says, yeah, I feel this more in my hip, it means that sciatic nerve is kind of restricted as it goes to the hip. If someone says, I feel it more in the back of my knee, that is a little bit more restricted there. All right, so same thing here. And stretch but not pain, so let me know. All right, so let's back off there. We don't want pain. You feel pull there? Okay, and then bring your toe down towards you. Yeah, and then go back and forth there. So just keep going back and forth till I tell you to stop. Yeah. So you should feel it. You want to feel a stretch, but not pain.
Yeah, I feel the stretch in
Yep.
my calf.
Yeah. Okay, and then keep going back and forth there. All right, good. All right, so now let's sit up. All right, and then stand back up here.
Oh, I know, I'm a little,
You catch your bearings here?
yeah, gotta get better.
All right.
That always happens, so I lay flat, okay.
All right, so you have pain right now?
No,
But you didn't have pain when you were standing up before. All right, so kind of slide your left hand down your side, and then worse, better, same.
now a little better.
So motion is better. You guys probably don't see that, but the big thing that we look at is, did the range of motion improve? And that improved a lot. You guys probably didn't see that, but the range of motion improved a lot, and it feels better, right? So did I just like fix her problem? That was easy, right? 10 minutes? Okay, that's part of it, right? That's part of the problem. The bigger problem, I think, is more the stability. And we're gonna talk about how stability plays a role in the lumbar spine and how that moves. All right, big hand. Thank you. All right, so let's go to your sheet here. Next thing we're on here is the #1 single biggest mistake that sciatica and low back pain sufferers make is that and that's the actual letters that are in the word. What do you think it is? Yeah, you guys got it. Ignore it. That's human nature. Everybody does that, right? You get back pain or heel pain or something, and like, kind of hope that it goes away, right? Usually it doesn't. So, but that's human nature. So don't feel bad if you said, oh man, I've had this back pain for years and I haven't done anything about it, and now I finally show up in front of this guy and I'm going to be embarrassed because I said I haven't done anything about it for years. Probably average length of time for my low back patients is somewhere around 9 months. So they go for back pain for an average of 9 months. Now some people are a couple days, some people are 7 years. So average is about 9 months. So that's just human nature. That's normal. So let's talk about your options with back pain. So the next one is, the first option here we talked about, you can ignore it. So do you guys want the fire alarm analogy or the leaky roof analogy? I'm going to give you one of them. You want to know the fire alarm one? All right, good. All right, we're in a room right now. Tyler goes in back and lights the bar on fire. What's going to happen? It's going to be a fire. I would hope that an alarm would go off at some point, right? So what are our options? We could walk out, right? I can leave. My truck's over there. I drive away. I mean, I've essentially eliminated the problem, right? It's not my problem anymore. We could all do the same thing. The problem is, if I come back here and I want to do a talk, there's not going to be a clubhouse because it's going to be burned to the ground, okay? So that's ignoring it. Another option would be what? We could grab a fire extinguisher, try to put it out. One of us is probably going to call 911. There's going to be some professional firefighters to come here to take care of it. And probably the worst case scenario is, we kind of burn the bar. There's other places to drink around here, right? That's not the only bar? I hope not. So that gets damaged, we clean it up, and we fix the problem, a small problem. Bigger problem is if we just leave and ignore it. Now the whole place is gone. Okay? So that gives you kind of an idea of what goes on with back pain. When you're having pain in your body, it's your body telling you that something is wrong. It's a really important mechanism for a human. There's some humans that are born without an ability to sense pain. Man, they're in trouble. Pain is a really important part of our human system that lets us know that something's going wrong. Okay? The next thing you can do is that you can alter it. Okay? So that's the next blank there. So has anybody ever used a back brace before? Yeah? So what happened? Help? Not help? Uh-huh. Uh-huh. Can't move with that. Yeah. Lots of different back braces, but the back brace analogy is kind of similar to what happened here, right? So she was up here, says, yeah, pain with that. I provide some stability. And she says, yeah, it feels a little bit better. So I did some of the job that the muscles are supposed to do. So you can alter that back pain. So you guys ever gone to Home Depot or Lowe's and see the guys with the big back braces? Okay. I'm not going to see that guy or that girl because they pick something up with their back brace on. I'm going to see them when they go home, take the back brace off, and go and tie their shoe. Yep. So that back brace it's really effective in treating acute low back pain. Like if someone has really bad low back pain and you put a back brace on them, very effective in decreasing that pain because it does the job that the muscles are not doing to stabilize those joints. The problem is it's not a really good long-term solution. So you don't want to have to rely on something to provide the stability for your body. You want to try to turn the muscles on to do that. And some people will use them kind of proactively, like they hand those out when you sign up and fill out your W-2s at Home Depot because they don't want people to hurt their backs. The problem is they're not going to hurt it at work. That's good for them. They're going to hurt it at home when they don't have that back brace there to do the job that it's supposed to do. So you can alter it, okay, but we haven't fixed the problem if we're using a back brace. Another way to do it that's super common is medication, right? So has anybody ever taken medication for their back? So if you've gone to your primary care physician or an emergency care situation, then typically, at least this is what I'm seeing when they come into my clinic, muscle relaxer, pain reliever, anti-inflammatory, and unfortunately now a lot of what I'm seeing is antidepressants. So probably 50% of the people that come into my clinic with back pain are given antidepressants because clearly they're sad. That's why they have back pain, right? So the point is that doesn't change or it doesn't kind of fix the problem, right? Now, in some situations, very effective, right? If someone is really in a ton of pain, a lot of inflammatory response going on, using some medication to get that down is okay. But again, think of it as it's not a really good long-term solution, right? So, because what happens, you take the medication, sometimes you feel better, but then the medication kind of wears off, the pain comes back, and then you got to take that medication again. Yep, go ahead. Great, yeah, you figured it out. You answered your own question, right? So when you sit on something that it's more dynamic, it changes, then it's harder for your body to kind of turn these muscles on. So you could even accelerate that, like if you sat on an exercise ball, you ever see those big exercise balls? We have 1 million of them in our clinic. If you sit on that, that's harder for your body to kind of turn on and stabilize on, so I would imagine you have more pain with that. And when something is more stiff or more rigid, then that can provide some stability for you. Yeah, so that's super common. Yeah. Yeah. Yeah, so she's saying her car seat is terrible, right? So I've never seen a well-designed car seat. I don't know if they have some kind of deal with chiropractors or what, but the car seats are awful. I've never seen a good one. And they've put in like lumbar supports. Those are terrible too. It's a hard situation to be in. So yeah, that's super common, unfortunately. Right, yeah. So especially if you're taking long trips and you're in that position for long periods of time, that puts a lot of stress on the joints in your low back. Yeah, so that's super common. Mm-hmm. Just did a crossover leg stretch? Yep, piriformis stretch. Yep. Right. No problems. That's good. Yeah, so she has a piriformis syndrome. So piriformis is an external rotator of your hip. It attaches here, and right underneath your piriformis runs your sciatic nerve. And about 15% of people, it actually runs through your piriformis, which is problematic because then you have to really have good piriformis mobility. So if that muscle is tight, then what happens is it puts pressure on the nerve, and then it causes pain. So that's a super simple thing to fix. You just stretch out the piriformis, then you're all set. Yeah. Yeah. And that's important too, right? So she didn't like fix the problem and then not do it ever again, right? So she does the stretch every day because it's worth the investment, right? A minute a day, no back pain, worth it, right? So, and a lot of times in physical therapy, people think, oh, he's gonna give me like an hour of exercises a day. I don't give any more than 5 to 7 minutes a day. I'm really busy, people are really busy. If I send you home with 30 minutes worth of stuff to do, none of it's gonna get done. If I say, hey, give me 5 minutes a day, then we're usually on the same page. Yeah, something as simple as that can be what you need to fix it, so that's great. All right, so now we're gonna go through the most common causes of low back pain. So we kind of looked at motion, and now we've got kind of an idea of what's going on. Now we're gonna go through the causes and talk a little bit more anatomy. So, as we fill this in here, number one, herniated, what do you think that word is? Disc, all right, you guys have had some MRIs, I'm guessing, right? Some diagnostic testing. Herniated disc, and this is pain with bending, which way? I'll give you two options. Pain gets worse if you bend forward or if you bend backward. Which one do you think gets worse with a disc? Forward. Wow, you guys are good. Okay, so let's talk a little bit about anatomy. All right, so what do you think these are? Close. Vertebrae. There we go. All right, so these are vertebrae, and in between the vertebrae is what? Yeah, got it. Okay. So in your lumbar spine, there's 5 vertebrae. In your thoracic spine, there's 12. In your cervical spine, there's 7. So in the lower back, which is what we're going to focus on, there's 5 of them. And 95% of all problems occur here. L4, L5. Okay. You guys, you're saying that right? Because you've heard that on your MRI. Yep. I'm like a fortune teller. Before I get people bring me MRIs, they're like, you know, I don't need that. Do you have an L4, L5 herniation or disc problem? They're like, oh my God, this guy must know what he's doing. Yeah, it's because 95% of them occur here, okay? Then we'll go through why that is, but let's go through basic anatomy first. So, this is the disc, and we talked about this. The disc is what? It's a shock absorber, but it's what? A ligament, yes. Ligament attaches bone to bone. So this disc's job is to make sure that these two segments move properly. So if these are two segments, right, it has to move some. If it didn't move at all, that'd be bad. It'd be fused. That's really bad. So if this is normal motion, okay, so fused would be this. It doesn't move at all. Moving excessively would be this. And that's the problem. That's a majority of what I treat, is this thing moves too much on this thing because this disc is impaired in some way. Okay? So this thing is kind of like a jelly donut. I don't love that analogy, but on the outside is kind of a thicker, rubbery, fibrous kind of material, and on the inside is more of a gelatin material. Okay? So if this is us, and so this is the front, this is my back, if I bend forward and I increase pressure here, what do you think this material is going to do? It's going to probably go that way, right? Yeah. So what's the problem with that? What runs right behind here? Anybody know? It's your spinal cord. Very good. Okay? So your spinal cord is really important. And right behind there are these discs. And then off of your spinal cord run your spinal nerve roots that provide sensation and motor function to muscles, legs, sensory tissue that go down the back of your leg. So if this material escapes, right? So there's lots of different findings on MRI, bulges, herniations, ruptures, irritations. Any kind of pressure on the spinal cord or on the spinal nerve root, which is where this kind of runs out, causes pain, numbness, tingling, and burning. Okay? So bending forward is usually what makes this worse. And that's what we have here. It's usually age what or younger, do you think? Yeah. That's true. You can have disc herniations at any age, but it's usually ages 40 and younger. Yeah, it's usually because what happens is, I gave you the jelly donut analogy. Another analogy is it's kind of like a grape that turns into a raisin. So as you get older, you start to lose water content. So this gelatin material starts to turn a little bit more into the fibrous material. Okay? And usually as you get older, you get a little bit shorter. Okay? Is anybody shorter now than they were like 30 years ago? Okay. Yeah. I used to be like 6'4", but now. But what happens is there's a lot of these discs that are in here, and then as they each get smaller, that adds up. And actually a lot of the vertebral body height, so you start to lose some height there too. Okay? But as you get older, this material kind of gets a little bit harder, and then it's harder to herniate. Okay? So that's one of the good things about getting older. You don't have as many disc herniations. But usually this is our younger population. And then what happens is it puts pressure on here, and that causes that pain that goes in there. So usually bending forward, it makes this worse. Yeah, go ahead.
I know somebody that had a disc removed, and what happens when they're removing that ligament?
Yep, so it depends on what happened during surgery. Did they fuse the joint or no?
And he's 60 or 70 something with back injury, and he says they just took that disc out and fine.
There's lots of different procedures, and I'm not a spinal surgeon, okay? So this is just information. I don't go to your spinal surgeon and say, my physical therapist said this. They can take that disc out and replace it. They haven't had a lot of success with that, okay? Sometimes that happens. They can take that disc out and fuse the joint. Why do they fuse the joint? Has everybody heard of a lumbar fusion or a joint fusion? It means, yep, so it's when they glue it shut. They put super glue in there. Why did they do that? Because it moved too much, right? So we talked about excessive motion. If you don't turn on the muscles to stabilize those joints, one option is just to glue it shut. Here's the problem. You're not going to lose a ton of flexibility initially, right? So there's 5 of these things. So if we spread that out, it's not like you're going to be walking around really stiff. Here's the problem. I can schedule you in about 5 to 10 years to get this joint and this joint fused, because that's what's going to happen. Because what happens when I fuse this joint? If this, anywhere in the spine, if this joint doesn't move, this joint and this joint has to move excessively to make up for this. Okay? So that's the problem with fusions. Fusions are a last resort. Okay? And sometimes they're very effective. You'll talk to people that have had fusions and are thrilled with them and are doing great. Okay? But some people will not have that story, unfortunately. Because if you take away mobility here, you're going to ask for it from other places that are probably a little bit worn down to begin with. Yeah, go ahead. So you've heard that? So she's saying she's heard that the lower back is harder to treat than other parts of your body. Like you'd rather have a shoulder problem or a knee problem than a low back problem, right? Is that what you're saying? Yeah, it can. So it depends on the patient. It depends on the tools that you have. If you don't know what you're doing, any problem's hard to treat. But, yep, so she said she's had cervical surgery. She's fine. There's tons of people that have had surgeries that have great outcomes. I typically don't see those patients. I see the patients that don't have the great outcomes. Yeah, yeah. So I think the answer to your question is if you know someone that knows what they're doing, then they can fix any problem in your body. Right? But if you don't, then you're in trouble. Yep. Okay. Okay. So he has a stabilizer, like he has a cage in there? So he might have a spacer. So we're going to talk about stenosis next. Let's just go right to that. So the next one on here is stenosis, DDD. Anybody know what that stands for? Degenerative disc disease. If you've seen MRIs, then you've probably seen that there. Or the really general term for it is what? Stenosis and then arthritis. Like if someone says, hey, we did an x-ray, you have arthritis. That's usually what that means. Arthritis just means the space in between here and here is smaller. Okay? So they look at x-ray. What is the space between here and here? Is that normal compared to here, a couple segments up, compared to your age, compared to what it should be? If it's a certain height, they say you have arthritis. But that's what that means. So this is usually pain with what? What 2 things? We talked about it a little bit. So this is the grocery cart one. So pain's going to get worse with standing and walking. Okay? And then it's going to be relieved with sitting. So this is the person, if this is you, you can walk in the grocery store for a couple aisles and then you have to sit down. Pain goes away. Or you're in the park and you walk around one loop of the park and your back's kind of sore or your legs are sore and then you sit down and you feel, oh, it feels better. Okay, this is you. So the stenosis, what we're talking about, is just a narrowing of the canal where the nerve root comes out. So right here and here and here, there's a space and it's small and the nerve root has to come out of there. So what happened with you is if this disc degenerates, if this space gets smaller and smaller, what they did is they put a spacer in there, so they put some kind of implement in there to kind of open up that space so that that nerve root can move smoothly. Because what happens is the smaller that hole gets, the more it kind of pinches down on the nerve, the more pain you have that goes down your back and down the back of your leg. Okay? So, does it make sense? This is kind of the opposite of the disc problem, right? So this is me again. Here's the front, here's the back. I bend over like this to get relief on my cart because why? Because it opens up that space, right? And then if I stand up straight, or if I walk and my hip gets into extension, what happens to that space? It gets smaller. So that's why people walk around on the grocery cart like that, because it closes down the space if you're straight up. If you're bent over a little bit, it actually opens it up a little bit. The problem is, again, you don't want that to be your long-term strategy, because eventually that person is going to go to stand up and they're not going to be able to do it because they spent so much time here. Okay? All right, good. The last one is SI joint. Anybody know what SI stands for? It's sacroiliac. You ever hear of that? Okay. All right, so your sacrum is your tailbone. So at the bottom of your spine is a triangle-shaped bone down there. And then your ilium are, if I say put your hands on your hips, you're really putting them on your iliums. So these big pelvic bones. Okay? So there's two SI joints. There's one on your right and there's one on your left. Okay? Those two big pelvic bones come together and they attach to your sacrum. And there's two joints there. Now those joints don't move a lot. Okay? So those joints are kind of slide joints. They barely move. It's not like an elbow or a wrist. It mostly moves in pregnant females because their hips have to open up in order to give birth. So if you've given birth to anybody, you kind of know what that's about. You get an increase in estrogen and other chemicals that kind of cause laxity in the joints. It causes the joints to move more than they normally do, which is a good thing, because if it didn't, childbirth would be even harder. Okay, so it's kind of the bridge between the lower extremity and the spine. It's what's in between when you put your foot on the ground and ground reaction forces come up. It's a shock absorber to kind of taking some pressure off of the lumbar spine. That's the most general way. It's kind of a complicated joint, but that's the most general term we can use. And this is ages what to what, do you think? So this is a trick question. It's ages 9 to 90. So I've seen someone as young as 9 with this problem, and I've seen someone as old as 90 with this problem. It usually skews younger. These people are my pregnant moms, multiple pregnancies, females that just have more estrogen in their system than males, so that joint tends to move a little bit more. When I do see it in males, it's usually my rotational athletes, so my golfers, my guys that play tennis, a lot of yard work like bending, rotation, that kind of stuff. That's when I'm going to see it in males. And it's usually, pain is worse with sitting or change in position. So this is the patient that comes in and says, yeah, when I change position at night, rolling from side to side, or getting from a low seat to standing, like moving from sitting to standing, that's going to bother them. And they'll almost always say, I get pain like right here. And they'll point to one of their SI joints. Okay, that's kind of the telltale sign that they have some kind of problem. It's very specific to the pain is very specific to the area where the problem is occurring. Okay? So, what does successful treatment look like? So we're going to talk about physical therapy. I'm a little biased. I'm a physical therapist. But physical therapy, and you guys said you've had physical therapy before. So physical therapy varies quite a bit too. I mean, we've talked about chiropractic, and you can do some chiropractors that don't manipulate joints at all, to some that's all they do. There's a lot of variation in between, and sometimes that happens in physical therapy too. But successful physical therapy, the number one thing that you have to do is manual physical therapy. So if you went to physical therapy and somebody handed you a sheet of exercises and you got on a bike, like you didn't have physical therapy. I'm sorry you paid for that. But if you're not getting hands-on treatment to kind of fix the problems that are going on here, it's going to be really difficult to fix spine problems without mobilizing it. So it's manual physical therapy to mobilize the pelvis and or lumbar spine. So that's the answer to the first one there. So that looks like we do joint mobilization. So manipulation, if you guys have ever been to a chiropractor, like that popping, cracking kind of stuff in your spine, if that's appropriate for you, then it's something that we do. It's not our number one modality. It's not the first thing that we go to. But it can be effective in treating specific joint dysfunction, typically in people that are a little bit younger. So you won't see us, for most of the age of this group, you won't see a lot of joint manipulation in my clinic on you guys. We use more mobilizations and self-mobilizations that we would do. So also kind of the self-mobilization that we did here. So just getting the joint to its end range, getting the sciatic nerve to its end length, and then just kind of moving the foot back and forth. As I hold that, I'm kind of monitoring that. That's part of manual therapy. Stretching, if you're having tightness in your piriformis, we would do stretches in treatment, but we'd also give you tools to do that at home. And you're doing it at home, and you don't need us anymore, which is great. All right. Number 2 is exercises to stabilize the pelvis. So we talked about the back brace example, right? So I can walk around all day and kind of do that job. I'm very expensive. It's very expensive for me to do that. Or you can put a back brace on, right? Or you can just learn how to turn those muscles on. And if you learn how to turn those muscles on, then you don't need any back braces. So it's specific exercises. And what gets thrown around a lot in our clinic and with the general public and the internet is like people that have back pain have weakness in what muscle groups do you hear a lot of? So people will say like their core muscle groups. Have you guys heard that? Okay. So if we said, yeah, if you went to the doctor, yeah, it looks like your abdominal muscles are weak or you have some core weakness, what exercises do you think you should do to do that? What's that? Sit-ups. Okay, we hear that. What else? Leg lifts, planks. Okay. Uh-huh. Feet on it and go side to side? Okay, so that's actually a good one. But most people will say sit-ups, right? You need to strengthen up these muscles. It's like the worst thing you could do for your back. Okay, so the exercises that you would do in physical therapy, they would probably look a lot different than what you would think they would look like. They're very specific exercises to turn on specific muscles that stabilize those joints. It's not these six-pack muscles like they see in magazines. Those muscles have nothing to do with lumbar stability. It's more the deeper muscles and pelvic floor muscles. Go ahead. So if you lay in your bed and you have a big exercise ball and you put your feet on top and you kind of roll side to side, depending on what your problem is, if it's a mobility issue, that's very good. If you have a hypermobility, if this is moving excessively, and then you get on that ball and move it even more, then sometimes that can aggravate the symptoms, so it depends on your symptoms. If you did that and it felt better, keep doing it. If you did that and it feels worse, I would stay away from it. Okay. And then the last thing here is traction on an unweighting treadmill. Has anybody ever heard of traction for low back pain? What's that? Got it, okay. Typical traction would be if it's a table situation. There's a crank on one end of the table, a crank on the other end of the table. You put these big vests on, and yeah, exactly. It kind of stretches you out, okay? You've heard of it?
A friend of mine does it in Florida, and she said it's wonderful. And it helps her for months and months.
Okay.
When she goes back.
Okay, so why would that help? Why if we kind of stretched, if we kind of pulled apart, what would happen? That space would get bigger, right? Right? So what typically happens, that's a pretty good result, but what happens? She has to keep going back and doing that, right?
Well, maybe in 10 months or so.
Yeah, yeah. That's a really good result. Like if she's getting results with that, that's great. Most people don't get those kind of results because they'll do the traction and say, yeah, it feels good, but then a couple days later, it kind of goes back to normal, right? Because it's not a very functional position. Another thing that people will do is they'll do an inversion table. You guys ever heard of inversion tables? So it's where you hang upside down, and then your feet are strapped in. It does the same thing, right? But it uses gravity, and then it kind of decompresses the spine. Yeah, so hang up upside down. Yeah. 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 And then, yeah, depending on your cardiovascular health, I'm not sure that I would, suggest that. Yeah. Yeah, and then it decompresses the spine. It can be good for short-term relief. But typically, people, don't get very long-term relief of that because you go back to normal situation, compresses. There you go. Perfect. Yep. And we refer out to yoga instructors too. So once you're done with physical therapy, getting into yoga is something that's very beneficial, definitely. What's that? So, physical therapists do it. So what I'm getting to eventually is that situation. For me, there's not a lot of carryover. So what we do is we got these unweighting treadmills. So we have these treadmills in our offices where you put the vest on, and I can take as much as 200 pounds off your body, and then you can walk. So it's a more functional situation when I can decompress your spine, and then you actually walk, as compared to laying down or being upside down. I'm sure you guys don't spend a lot of time upside down, but it's not a terribly functional position. I'd rather have you up and walking. So in our Allentown and our Easton office, we have unweighting treadmills. So when we're not getting the results that normally work, sometimes we'll do traction with walking, and that's what the last thing that we need to do to help that. So some physical therapy clinics will have the traction unit. Some chiropractors will have traction units. Yep. So, yeah. Depends on your cardiovascular health. I don't want you to have an aneurysm. Yeah. So she said, yeah. So the answer to that question, And the answer to anything, if you're doing something and it feels better, you probably should keep doing that, right? If we said everybody go in the corner and stand on their head and it relieve their back pain, we should probably just do more of that, right? So it depends on if that's working for you. So same thing, we do a piriformis stretch, completely eliminates your back pain. Guess what? You should keep doing that. It's a good idea, right? So if that's working for you, great. It wouldn't be the only thing I would do. Yeah, yeah. Mm-hmm. Mm-hmm. Yep. Yeah. Yeah, and for you, based on what I saw here, just in a quick evaluation, you're probably going to benefit from something like that. Yeah, definitely. All right. Anybody have any other questions? Like general questions? Go ahead.
Yeah, when you were describing the various causes of back pain, the one that struck me as being closest to my situation would be sacroiliac pain because I don't have much pain standing at all. I can stand for a long time. But when I'm sitting, when I get up, stand up from a sitting position, getting in and out of the car, turning over in bed, that's when I get back pain. But I always have a kind of a low-level ache in my lower back and the back of my legs. I mean, that's there all the time. Is that consistent with that kind of a problem?
Yep, so my best bet with you is we'd probably find after doing an evaluation you have a leg length discrepancy, which means one leg is longer than the other. And that's usually what happens when one of your iliums is not in the proper position. So you're saying you have pain here, but then you have like this general ache. Well, typically when something goes wrong in the body, it doesn't just stay there, right? So things tend to happen bad up and downstream. So if you're having this SI problem here, it's going to affect your lumbar spine and it's going to affect your hip. So that general ache in the low back, it's probably the compensation that your lumbar spine is making around the fact that your SI joint on that side is probably stuck out of position. So if we unstick that and then turn the muscles on that stabilize those joints to make sure that it stays in proper position, then that's an easy fix. Yeah. Another question?
The mild scoliosis from childhood,
Mm-hmm.
by now at this age, affects a lot of how we feel our backs,
Mm-hmm.
right?
Yep.
And you can't change it, it's the way you're curved.
So severe scoliosis is difficult to change. Everybody has mild scoliosis. If we put you up on an x-ray, there's nobody in this room that would have a pin straight spine. I guarantee, including me, right? Including Tyler, he's really young. Okay, it just doesn't happen. Okay, so unless you're having some like people that have severe scoliosis, you'll notice it. Like you can notice that. You don't need a medical degree to figure that out. That becomes a little bit more problematic. But everybody has a little bit of scoliosis, and that can be genetic. It can be something you're born with, or it can be a compensation that your body is making around another problem. So that's the most common things that we say. And usually, if it's not visibly noticeable when you walk in the clinic, then that's something that we can fix. Yeah. Yep.
I had to give up sleeping in a bed. I could make it for 2 hours, and then I had such a backache I couldn't make it through the night. I couldn't go back to sleep. So I started sleeping in a recliner. I can make it all the way through the night pain-free in a recliner. Why is that?
Why is that? It's because the position your spine is in. So for you, most likely you have some stenosis going on. So when you lay down flat on a table, think about that as the equivalent of standing. Okay, so when I'm standing, my spine is straight. And we talked about that when it's standing, that hole gets a little bit smaller and puts pressure down there. So in a recliner, when you're sitting, what happens? You're kind of bent forward like that. You don't look like this, but if you take me sitting at the edge of the table, what happens to my spine? My spine opens up. Then that's where, if I have your problem, if I have stenosis, that's what I'm going to like. Yep.
But I slept on my side. I didn't sleep on my back, so I didn't have that curve issue.
What position were your hips in? Were you bent, curled up like this, or kind of down? Hard to tell.
Yeah, either like this or straight, but I was on my side the whole time.
Yep. So also when you lay onto your side, depending on the width of your hips, then that can kind of compress the same thing. So same thing when I get into extension, I'm going to close this hole, but let's say I'm having problems on this side. If I lay on my side, okay, and then I do this, I'm going to make that hole smaller. So do you remember what side you used to lay on?
Mostly on my right side.
Did you have pain on that side?
Yeah, I had pain on both sides.
Yeah, yeah.
But that would wake me up because I would be on my right side and I would have such a back pain that I couldn't sleep.
Right. Right, so your body's telling you there's something wrong, and you did something to alter it. So you can sleep fine now, you just have to sleep in a recliner. If that's the long-term strategy that you want to take, then that's okay. But if you want to try to find out what's caused it, that's not normal. It shouldn't be that you get to a certain age or you get to a certain condition and it's like, well, now I have to sleep in a chair. That's not normal. Right? So it's up to you what you want to do with that.
There's a big industry in sleep chairs, though.
That's
There
true.
must be a lot of people that are in the same boat.
Yeah, that's true. Yeah, no, sleeping position is one of the most common things that people will come into us where say, it bothers me during the day, but when I try to sleep at night, man, that kills me. And that's really important, especially for nerve irritation. Like if you're not getting enough sleep, if your body's not recovering at night, you can't recover from the inflammatory responses that are really common with low back pain.
Does the type of mattress make any difference, like a Tempur-Pedic versus a coil or
Right.
whatever?
So great question. Everybody thinks there's like a mattress that will fix your problem, right? So the answer to the question is you need to find the mattress that works best for you. Now that can be expensive, right? You have to go through 3 mattresses to find out which one is yours. That becomes a problem. But the answer to the question is you have to find out which one is right for you. Some people respond better to a firmer mattress. Some people respond better to a softer mattress. But think about the example here. So she says, when I sit in a soft chair, I don't do very well, right? Typically, when you lay into a soft bed and the joints are allowed to move a lot, then that can cause some problems. So I'll give you, it's really what works best for you. And that's probably the best takeaway that I can give you. If you're doing something that's working, then you should keep doing that. So I'll give you an example. We do lots of studies in the military. Why? Because they're like required to do the studies that we have them do. So one of the big things that we study in the military is the boots that we give them when they come into basic training. Anybody ever been in the military? Yeah, yeah. So they give you boots. So they said, you know what? We're doing these 10-mile hikes with 80 pounds rucksacks, and we're getting a ton of like foot fractures and ankle sprains and all sorts of foot and ankle problems. Maybe we should look at the boots. So they started to look at foot structure. So does this person have a high arch? Do they have a low arch? Or do they have a medium arch? And based on their foot structure, they gave them a custom boot for that problem. And what do you think happened to the next group of recruits that came through? Did the problems get worse or get better? We gave them a custom boot for their problem. Problems got worse. Like they had more injuries, right? So next thing they did is they said, hey, why don't we let them pick the boots? So they tried the boots on, walked around in them, and the recruit said, hey, I think this is best one for me. Even though, like, man, you've got a high arch, you're wearing a low arch boot. I don't think that's a good idea. He goes, yeah, these ones feel like the best for me. And injuries went way down. So the answer to the question is, you've got to find out what works for you. And it's not universal. So I wish I could tell you, everybody should have a firm mattress. I would sell mattresses, but it just doesn't work that way. People with back pain get a firm mattress, and the back pain gets worse. And they go back and say, I need a soft mattress. And man, that physical therapist didn't know what they were talking about. So it's what works best for you.
Well, you got 2 things going on there too, because if I go on a firm mattress, then I get pain in the joint on the side, which I didn't have before. Which in a soft mattress you didn't have that, but maybe that was better for your back. So neither one.
Yeah, I'd be interested to find out why you're having pain in that hip. So I would be interested to see what's going on there.
It feels like I'm sleeping on the floor if I sleep on the hard mattress.
Yeah, yeah, yeah. So the answer is it's complicated. Work with what's best for you. But I want to find out why you're having the back pain and the hip pain, and then you can sleep on any mattress you want. Yeah, go ahead.
Once you're inflamed in a joint like that, and you're gonna treat us, how many months does it take for the inflammation?
Months, man. Okay. So average length. Jeez, if I didn't fix people in 6 months, I don't know if I'd still be in business. But
Not that you fix it, but the inflammation, how long does it take for the inflammation?
right. So you've got to remove what's causing the inflammation. And it's usually a mechanical dysfunction or it's something that you're doing during the day that we have to find out. It's a movement dysfunction. You're moving and you're irritating that joint or that ligament or that muscle or that nerve. We've got to find out what tissue is causing the problem. Once we find that out, we have to correct the movement dysfunction. So you're moving incorrectly. We've got to kind of correct that to take pressure off of it, to take stress off of it. Right? So if you had a cut in your arm and I just did this to it all day, it would never close up, right? Okay, we're bending forward or backward or the side of our spine thousands of times a day. If you're not doing that properly and you just keep doing it, it's going to continue to cause that irritation. So the first thing is to find out what the cause is and then attack that. But to answer your question, average length of stay for, and we've talked about 3 different kinds of low back pain, but in general, if you put everybody into a bucket, it's around like 12 to 15 visits. In the beginning, it's like 3 times a week for 2 weeks. I want to see it pretty intensely because I've got to teach you you have to relearn how to move. So that requires a lot of instruction from us. And in physical therapy in general, it's very front-loaded on the physical therapist, and then we eventually shift responsibility to you. Right? So it's not like you need to see us once a week for the rest of your life. If you have to do that, or if you're doing that now, you're going to the wrong place, because you should fix the problem, and then I give you the tools to maintain it. And then if something happens later on, then come back in and get a tune-up. That's fine. But that's what it looks like is usually around a couple times a week, 4 to 6 weeks.
I've had two doctors tell me in the last 6 months, do not take a leave. It's bad for your, at your age, it's really bad for you.
Mm-hmm.
So a lot of people our age live on leave and Advil.
Right? You're altering it, right? So you take a leave or Advil and feel pretty good. And right, you're controlling the inflammation, or you're controlling the pain response. Right. Yeah. That's not a really good long-term solution. Unfortunately, it is a lot of people's long-term solution. Well, I feel fine if I just take a leave. I've only been taking a leave 6 years. I'm like, I don't know what your kidneys and your liver look like, but not as good as they looked 6 years ago, right? So now short-term use of that is, a short-term solution for that I'm okay with, but we've got to find out what's causing that problem. If you don't find out what's causing it and fix that, then you're going to have to, it'll be a leave, and then you'll have to graduate up to something else, because eventually leave's not going to work, and then you're just not fixing the problem. Yep.
Will Medicare pay for this if it's not due to an injury or operation or some such
Right.
thing?
Good question. So most people in this room, I'm guessing, have Medicare. So how Medicare works is, let's go. So Medicare has an 80-20 policy. 80% is covered by Medicare, 20% is your responsibility, or if you have a co-insurance, most people with Medicare have a co-insurance, they usually take care of all of it. So if you come in round numbers, it costs $100 to have a physical therapy visit, Medicare is going to pay 80% of it, you're going to pay 20% of it in the form of your co-insurance, or you pay it on your own. Medicare pays for physical therapy. Hey, you don't have to have fallen out of a car or have some specific injury to pay for physical therapy. They're very invested in physical therapy, because guess what? If I fix your back pain, it's going to cost somewhere around $1,000, $1,500. Medicare's going to have to pay that out. Guess how much a lumbar fusion costs? Somewhere around 80 grand. So they're a little bit more interested in having you go to physical therapy and fixing that problem, and you are too. I mean, Medicare is definitely concerned about the numbers. I'm concerned about you and your spine and not having you have a fusion. Go ahead. Yep, good question. So here's what happens. If you have Medicare, so physical therapy in general, in almost every state we have direct access. So if you had regular insurance like Blue Cross Blue Shield, you don't need a prescription for physical therapy. What Medicare requires is they get a plan of care signed by your doctor. So you can do a couple things. One, you can get a prescription from your doctor. Most people, I almost never, when a patient says, hey, calls to the doctor, I'm going to go get physical therapy, can you just write a prescription and send it here? Almost never. I probably know all your doctors if you live in this area, because I've been here for a long time. So they'll say, yeah, you're going to see Travis, whatever, I'll write you a script for physical therapy. Or what can happen is if you come in, we would do an evaluation. So we would do a full evaluation, write up a plan of care, and then we can send it to your doctor. We can't treat you that day, but once the plan of care is signed, then we can treat you after that. So typical course, people will come in and say, hey, I want physical therapy. Great, we'll do the evaluation, we'll send it over to your doctor, we can start as soon as they sign off on it. Medicare still does require that. That will change eventually, but they require that. So 2 ways you do it is if you have a prescription in hand and you come in, we can do the evaluation and I can treat you that day, which is what I want to do. If you don't have a prescription, that's fine. You just come in, I do the evaluation, I write up this big report, and I send it to your doctor, I say what I'm seeing, and then he or she signs off on it, and then you can start physical therapy. That's how it works. Yep. By Medicare, no. Okay, so the acupuncturist I work with, she is in Allentown, and she does $20 sessions. I still don't know how she does that. So let's talk about this really quickly. So this 10%, remember I said 90% I fix it, 10% I need some help? Acupuncture works really well. So, and believe me, it's not something that is taught in our schools and is mainstream yet, but I'll give you an example. I treat my wife a lot. It never works out very well. She hurt her shoulder doing some crazy workout. She said, yeah, I could fix my shoulder. I came in, saw her a couple times. It's getting better. I said, you know what? Just go to the acupuncturist. She went 3 times, pain was gone. So, yeah. Yeah, acupuncture is great.
And it's $20 a session?
Yeah, she does it $20 a session. I don't know how she does it, but. Okay. It's just group, right? So she'll set you up, she'll ask you some questions, do some movement assessment. Bothers you when you do this, she'll put needles somewhere else. Does it feel better? Yeah, bothers you when you do this. And then you'll just kind of chill out for 20 minutes. More than that. Laura Eastman. Yeah, Eastman Acupuncture. It's down in downtown Allentown. Laura Eastman. All right, any other questions? You guys have good questions. We don't do it in my office. No, she does it in Allentown. So yeah, it's right around the corner from our main Allentown office.
Treat what kind of problems?
Anything. Like I send orthopedic injuries to her, like shoulder pain, back pain, hip pain, but she treats a lot of different stuff in terms of like depression and also it's unbelievable what she does. Yeah. All right, so now what? Here's your options. One, you can ignore it, right? So you can walk out and got some information here and hope that it gets better. You can continue to alter it. So I think the main altering strategy that we had was Aleve, right? So you can, if you're getting along with that, or you're kind of altering it too, right? So you're saying, I don't have too much back pain when I sleep in a chair. So that's a form of altering. We haven't fixed the problem, but you know, you're surviving with it. If that's the strategy you want to take, that's fine too. Or the last thing you can do is you can change it. So we talked about that. It's, if you want to look into physical therapy as an option, we have a couple different options. One thing we do is for people that have come to our workshops, we do a free screen. So you can come into our office. It's a 30-minute appointment with a physical therapist. We don't charge you anything. We don't take your insurance. You just get a one-on-one appointment with a physical therapist. You go through your history. We go through an examination. We tell you what the problem is. We tell you how physical therapy would fix it. We tell you about how long it would take and give you information about that. If you want to get started right away and you're like, yeah, I've got to start working on this, then I would suggest setting up the initial evaluation. So an initial evaluation is just the term for you come in for physical therapy. It's an hour appointment. We do more in terms of evaluation and testing and basically a longer version of the free screen. In that situation, we would take your insurance information, and if you have a prescription, we can treat you that day. If you don't have a prescription, we would just do the evaluation. We wouldn't treat you that day, and then we would communicate with your doctor so that they signed off on the plan of care so you could start physical therapy. Yep. All right, great question. Do I want to see x-rays? I'm not a radiologist, okay? I took coursework to read x-rays and MRI as part of my fellowship training, but I almost don't want people to have them because here's what happens. Yeah, if you already have one, bring it in, right? So, and I'll tell you the information that's on there. The most important thing is that part at the end where the radiologist, the guy or girl that spent 8 years in school to read those things, that's the information I'm looking for. I can look at stuff and I can point stuff out and say, yeah, you know, and it wouldn't look much different than this. Like, hey, the space here is not that great. Or you have a herniation here and that's putting pressure on the spinal cord. You know, that stuff I can kind of point out. But people get kind of attached to their MRI findings, right? So people come in and they say, I have a herniated disc. I'm just going to have back pain forever. So I have 2 herniated discs in my lumbar spine. I played football in college, blew out my back, and I never had back pain. Right? So, but if you look at my MRI, it looks like I should have back pain. And when you get MRIs, a lot of times it'll say, yep, herniated disc, this is what's causing the problem. That's not even what's causing the problem. So diagnostic testing, I would never tell you to not get diagnostic testing. That's not what I would tell you to do. I just don't want you to identify with it because a lot of times my patients get diagnostic testing. I have degenerative disc disease and severe stenosis and, you know, bulging discs and all these problems. Guess what? He has some of those findings on his MRI and he's 23. So that's normal, okay? It depends on if that's causing the problem. That's the important information. And anybody over my age or your age, I've never gotten an MRI back and at the end of it I read, looks good. Just doesn't happen. Never happens. So I just don't want you to identify with those because there's tons of people that are walking around with awful looking MRIs and x-rays and have no pain at all. That's a good question. Any other questions?
Just want to say something. I took physical therapy with Travis at Robinson Upper Montgomery. Great experience. I had plantar fasciitis, and I walked my dog about 2 miles every day, and it was very painful. And now I'm good.
I saw it too. I saw her walking her dog today.
No pain.
I know, that's right, babe.
What happens if they have a severe injury or something and you're going to touch them and you're not going to manipulate them, you're going to send them off somewhere?
Oh, so when we get free screens and something really bad is happening. So like we talked about, like really bad stuff is going to be like unexplained weight loss or unrelenting pain. Like I have 8 out of 10 pain from the moment I wake up to the moment I go to bed. Like, it doesn't change with position. There's lots of different screening criteria that when someone comes, general illness, if they're sweating when they come in, this happens 1 or 2 times a year where someone comes in and they're not appropriate for physical therapy. Like, they need to be referred out either to an emergency room situation, or it's like, now we got to get something checked out by your physician. But we're taught in school now, and now all the physical therapists, actually myself and my twin brother, we're the only physical therapists that don't have their doctorate. Because when we went to school, there wasn't a doctorate program. So now, the typical course of physical therapy, 4 years undergrad, 3 years to get your doctorate. So as part of that doctorate program, and as a part of direct access and what physical therapy is moving towards, is if you have pain with movement, you probably shouldn't be going to your primary care physician. I love primary care physicians. I don't know how they do that job. It's the hardest job on the planet. But if you're having pain with movement, you probably shouldn't be going to your primary care physician because they don't have the tools to handle that. Now, they have the tools to treat the symptoms, right? So we talked about if you've gone to your primary care physician, then what has probably happened, you've gotten some medication, or maybe you got an injection, and that's to kind of decrease the inflammatory response, which is important. But they're going to spend 8 minutes with you. In physical therapy, it's an hour to an hour and a half. Like, I have the time to kind of fix what's causing the problem. They're treating the symptoms. And it's an important job for sure, but what physical therapy is moving towards is if you're having pain with motion and you didn't cut your arm off, you probably should be going to a physical therapist because they're the experts in addressing what is causing that pain with motion. Like pool type stuff. So if someone has access to a pool, I'll give stuff there. Here's my problem with pools. Again, it's not terribly functional. So unless you're going to be spending all day in a pool, if that's your job, which some people do have that job, then once you get out of the pool and you're on land now, well, the pain kind of returns. I've got to make sure you do good, when gravity is having its full effect on you. Okay? So there are certainly things that I can give you to do in the pool if you want to do that, for sure. But for me, like pool-based physical therapy, like a lot of people I've seen, and they say, yeah, I had pool therapy. I think some of the big hospitals around here have some pools available that they do pool therapy for. The most common thing I see is I did really great when I was in the pool, but then when I got out of the pool, I didn't feel so hot. So I've got to make sure you do well out of the pool. Yeah. Good question. Anything else?
I think the pool relieves the inflammation.
It can.
Take away the.
Yeah, and that can be effective too. So if I can, same thing with the inversion table, right? If I can get you into a situation where we're kind of decompressing the spine and just giving it a little bit of a break, then that's good. It's not. I'm not saying that it's completely worthless. I have to get you doing well on land. Yeah. Mm-hmm. Yeah. Guys. Yeah. Right. And so does that make sense to you why that is? So when you're in a pool, you lose weight actually. It's great. Yeah, it decompresses you, right? So it kind of takes the pressure off of there. So we've got to fix that problem when you're on land. And that's usually pretty similar to what happened up here. So it's mobilization, trying to get the joints to move a little better, and looking at your nerve mobility. So if there's pressure here, and that's putting pressure down on the nerve, and that nerve's not allowed to move back and forth smoothly, and that's what causes that problem. Yeah. Yep.
Personal experience, I had two sinus in my head. I was on pain medication for only 2 weeks. And Nick, after all, I'm not awful the rest of the time.
Yeah. Yep. Yeah, definitely. All right, and the other thing, if you guys want to come in for physical therapy, you're probably going to say, hey, can I go see that Travis guy? Guess what? I'm not our best physical therapist. I'm just really good at talking, okay? So all the stuff that I learned and all of the things, and I've got lots of roles, right? So I'm not treating, I'm still treating 30 to 40 hours a week, but there's lots of other things that I have to do in terms of education. Like I'm not treating patients now, right? So I'm out here doing this. There's lots of things in terms of running a business and having a family. I'm not treating as much as my other physical therapists are. So if you're dying to see me, I will see you. It's kind of harder to get out of my schedule. I would love to see all of you. But know that if you go to any of our facilities, all the physical therapists that I have gone through a very rigorous training program, and a lot of them do stuff a lot better than I do. But they know all this stuff, and they know all the things that I know how to do, and they know how to do it better. So I'm saying if you want to see me, great, I would love to see you. Don't get disappointed if you get one of my other therapists because you're probably going to get a better one. All right, guys, I'll stick around. If you guys have any questions or want to talk to me, I got to get out of here in a little while. But thanks for coming. I love doing this. This was like my favorite. I usually say 45 minutes, but I always go over. This is the favorite part of my week, so thank you for coming out. I appreciate it.
I have a write-up from all the x-rays that I had. My doctor has it. Should I bring that to you? Because
Yeah.
it did say degeneration.
Yeah, bring it all in, and then we'll go over it, and I'll explain it to you for sure.
Okay,
Yeah.
'cause that's what I want to do.
Yeah.
I mean, you won't do it, but your physical therapist will.
Yeah, or you can see me if you want to come up my
okay.
country. Yeah, if you guys want to schedule, you can come up and talk to Tyler, and he'll get you scheduled in. pre-screen evaluation, whatever you guys want to do.
Oh, I gotta tell you, I have a nephew, Travis.
Oh, yeah?
Western PA, on a farm, a great big, wonderful.
What kind of dairy farm or?
Great big beef farm.
Oh, okay, beef farm. That's the way to do it.
They
Yeah.
got money. But he's given it up to go to St. Francis College to be a
Physical therapist? No way. We should tell him to move out here. He come work with us.
What town were you from?
Where am I from? I'm from upstate New York.
What?
Outside of Syracuse. It's called like Utica, New York.
Oh, I know.
Yeah,
Okay.
yeah.
I'm just curious. I've got a brother-in-law who's got problems up in here,
Neck, yeah.
in this area, and he's got pain. He's got to lay on the floor straight. He's always doing this. He's always doing that. 10 years ago, he went to a doctor. The doctor told him, "Well, you would need surgery to fix what's going on up there, and we don't want to go near that because